Peritonitis is a severe and potentially life-threatening condition characterized by inflammation of the peritoneum, the thin layer of tissue lining the inner wall of the abdomen and covering most of the abdominal organs. This inflammation can occur suddenly, acute, or gradually, chronic, and can be classified as primary, secondary, or tertiary based on its cause. Primary peritonitis, also known as spontaneous bacterial peritonitis, SBP, usually occurs due to bacterial infection without an apparent source in the abdomen, often seen in patients with liver cirrhosis and ascites. Secondary peritonitis arises from a rupture in the abdominal cavity, such as a perforated ulcer, appendicitis, or diverticulitis, which allows intestinal contents to spill into the sterile peritoneal space. Tertiary peritonitis refers to persistent or recurrent infection following adequate initial treatment, commonly in critically ill patients. The causes of peritonitis are varied. Primary peritonitis typically results from bacterial translocation in patients with ascites, whereas secondary peritonitis stems from a perforation or injury to the abdominal organs, such as a ruptured appendix, perforated peptic ulcer, diverticular disease, or trauma. Tertiary peritonitis can develop from resistant or recurrent infections in patients who have undergone previous abdominal surgeries or have compromised immune systems. Risk factors for developing peritonitis include conditions that weaken the immune system or create susceptibility to infections, such as liver cirrhosis, kidney failure on peritoneal dialysis, and inflammatory bowel diseases like Crohn's disease and ulcerative colitis. Other risk factors include abdominal surgeries, trauma, gastrointestinal perforations, and the presence of intra-abdominal foreign bodies. Symptoms of peritonitis can vary but often include severe abdominal pain and tenderness, which can be diffuse or localized. Other common symptoms are abdominal distension, fever, nausea, vomiting, loss of appetite, diarrhea, or constipation. Patients may also experience signs of systemic infection or sepsis, such as tachycardia, hypotension, and confusion. Treatment options for peritonitis focus on eliminating the infection and addressing the underlying cause. Initial management includes the administration of broad-spectrum antibiotics to combat the infection and fluid resuscitation to stabilize the patient. In cases of secondary peritonitis, surgical intervention is often required to repair the perforated organ and clean the peritoneal cavity. This may involve procedures such as laparotomy or laparoscopy. In cases of tertiary peritonitis, managing the persistent infection with targeted antibiotics and supportive care is crucial. Surgical management of peritonitis, especially secondary peritonitis, is a critical component of treatment. The goals of surgery are to remove the source of infection, debride infected or necrotic tissue, and irrigate the peritoneal cavity to reduce bacterial load. Depending on the severity and cause of peritonitis, surgical options may range from minimally invasive laparoscopic procedures to more extensive open surgeries. A comprehensive nursing care plan for patients with peritonitis involves close monitoring of vital signs, pain management, administration of antibiotics, and ensuring adequate hydration and nutrition. Nurses play a crucial role in early detection of complications, such as sepsis or organ failure, by monitoring laboratory results and patient symptoms. Patient education is also vital, focusing on the importance of adhering to the prescribed treatment regimen, recognizing early signs of infection, and maintaining follow-up appointments. Postoperative care includes wound care, monitoring for signs of infection, and promoting early mobilization to aid recovery. In conclusion, peritonitis is a complex and potentially fatal condition requiring prompt diagnosis and aggressive treatment. Understanding the types, causes, risk factors, symptoms, treatment options, surgical management, and nursing care is essential for effective management and improved patient outcomes. Early intervention and comprehensive care can significantly enhance recovery and quality of life for individuals affected by peritonitis. Subscribe to us for more videos like this and visit bazaarbiblio.com for notes and free PDF books. Thank you.